Hello, my name is Jamal Bankhead, and I am originally from Belzoni, Mississippi. The obstacle that I have encountered so far in public health, like I said before, was that oftentimes I applied for positions and oftentimes I was turned down because they told me I had the education, but I didn't have the experience. And I didn't know much about public health, so I pretty much didn't have someone that mentored me in public health. So I pretty much had to kind of create my own road and path along this public health journey. And how I did that was that I sought after internships and fellowships. So for instance, after I completed my master's in public health at Jackson State University in Jackson, Mississippi, I took an internship working at the DC Department of Health. So that required me to move from Mississippi to Washington, DC, somewhere I had never been before, for a one-year fellowship. And when I got to Washington, DC and got that fellowship, the opportunities just kept flowing for me. So I actually stayed in Washington, DC 7 years, and I was actually able to gain federal employment while I was there. So I think it was an obstacle at first because I didn't have the experience in public health, but as I sought after internships and fellowships, that gave me that experience I needed. While I already had the education to go with it. So they worked out perfectly. The advice that I could give to Black students who are interested in public health is that public health is such a huge area, and you don't have to, one thing I love about public health is that you don't have to focus on one specific area. And what I mean by that was when I became introduced to public health and started getting careers or jobs in public health, I went from various different things. I worked with human research protections. I worked with lung cancer. I worked with the opioid epidemic, and now I work with HIV/AIDS. So what I know, the most important thing about public health is that the education and the skills can transfer across various different diseases that you oftentimes see in public health. So one thing I want to tell Black students is to have an open mind and to kind of do the research. Because like I said, when I was introduced to public health, I was introduced to it as a elective course my senior year in college, something I just took just basically to take it. I really didn't have the exposure to public health. And what I found challenging was that a lot of the positions that I applied for, they oftentimes told me that you have the education, but you don't have the experience. So that was something that created a barrier for me, but how I addressed it was that I sought after internships and fellowships so that I can gain those needed experiences to apply and be competitive for various positions. And that has helped me tremendously along the way.